Welcome to our journey through nutrition across the life cycle. In this video, we'll explore how nutritional needs change from preconception all the way to old age and why these changes matter for lifelong health. We'll see how nutrition during key stages, like the first 1,000 days, adolescence, and adulthood, can shape not just individual well-being, but also the health of future generations. By understanding the life cycle approach, we can better prevent malnutrition, break cycles of undernutrition, and support healthier communities. Let's begin by looking at the core concepts behind life cycle nutrition and why it's so important in public health. Life cycle nutrition is an approach that recognizes our nutritional needs aren't static. They change as we move through different life stages. What you need as a child is very different from what you need as an adult or an older person. Importantly, nutrition at one stage can influence health outcomes much later in life. For example, poor nutrition in early childhood can increase the risk of chronic diseases in adulthood. Malnutrition can even be transmitted across generations, making early interventions crucial. Public health nutrition focuses on these critical windows of opportunity, especially in the earliest years. Let's break down the main stages of the life cycle: preconception, pregnancy, lactation, infancy, early childhood, adolescence, adulthood, and old age. Each stage brings unique nutritional needs and challenges. For example, pregnancy and lactation require increased nutrients to support both mother and child, while adolescence is marked by rapid growth and higher energy demands. Recognizing these stages helps us tailor nutrition interventions for maximum impact. A life cycle approach to nutrition is essential for public health. By addressing nutritional needs early, we can prevent malnutrition before it starts, break the cycle of undernutrition passed from one generation to the next, and improve overall human capital and productivity. This approach is also key to achieving sustainable development goals, as good nutrition underpins education, economic growth, and health outcomes. Maternal nutrition is a cornerstone of child health. A mother's nutritional status before and during pregnancy directly affects fetal growth, birth outcomes, infant survival, and the child's growth and development. When mothers are undernourished, their children are more likely to be undernourished too, perpetuating a cycle of poor health. Improving maternal nutrition is one of the most effective ways to ensure healthy future generations. The link between maternal and child nutrition is complex. Inadequate maternal nutrient stores, poor placental function, and low birth weight can all set the stage for impaired infant feeding and growth. These pathways highlight why interventions must start with women and girls, not just children. Addressing maternal nutrition is a powerful tool for breaking the cycle of malnutrition. Most child malnutrition actually begins before birth. That's why public health interventions must target women and girls, ensuring they have the nutrition they need even before pregnancy. By focusing on this early window, we can make a lasting difference in child health and development, reducing the burden of malnutrition for future generations. First 1,000 days, from conception to a child's second birthday, are critical and irreversible window for growth and development. During this time, the body and brain undergo rapid changes, and the immune system matures. Nutritional deficits or damage during this period can have lifelong consequences, making early nutrition interventions absolutely vital. During the first 1,000 days, the body experiences rapid cell division and differentiation, which means nutrient demands are at their highest. Any nutritional damage during this time is often irreversible, affecting physical growth, brain development, and immune function. That's why investing in nutrition during this window yields lifelong benefits for individuals and society. During pregnancy, a mother's diet must provide enough energy and nutrients for both her and her developing baby. Key interventions include a balanced diet, iron folic acid supplementation, adequate iodine, and infection prevention. These steps help ensure healthy fetal growth and reduce the risk of complications for both mother and child. For infants and young children, exclusive breastfeeding for the first 6 months is recommended, followed by timely and appropriate complementary feeding. Continued breastfeeding up to 2 years and beyond provides ongoing benefits. These practices support optimal growth, brain development, and immune protection during a child's most vulnerable years. Human growth follows predictable and sequential patterns, but it's also highly sensitive to nutritional insults. Growth is fastest in infancy, steadier in childhood, and surges again during adolescence. Understanding these patterns helps us identify when nutritional support is most needed and how to prevent growth faltering. Infancy is marked by rapid growth, while childhood brings steady, consistent gains. Adolescence is known for its dramatic growth spurt, and adulthood is when growth finally ceases. Each stage has its own nutritional priorities, and missing key nutrients at any point can have lasting effects on health and development. The concept of the developmental origins of health and disease, DUHA-D, shows how poor nutrition during fetal life can lead to metabolic changes that increase the risk of chronic diseases like diabetes, hypertension, and cardiovascular disease later in life. This highlights the importance of good nutrition even before birth. Fetal programming refers to how nutrient restriction during pregnancy can alter organ development, leading to babies who are small for their gestational age. These infants are at higher risk for non-communicable diseases later in life. Ensuring adequate maternal nutrition is key to preventing these long-term health risks. Preventing non-communicable diseases, NCDs, starts before birth. That's why maternal nutrition policies and programs are so important. By supporting women's health during pregnancy, we can reduce the risk of chronic diseases and improve population health for generations to come. Lactating mothers need increased energy and micronutrients to support milk production and their own health. Adequate hydration, continued intake of iron, iodine, and vitamin A are all essential. Meeting these needs helps ensure both mother and baby thrive during this important stage. Supplementation programs play a vital role in maternal and child health. Iron, folic acid, vitamin A, and multiple micronutrient supplements are commonly provided to address deficiencies and support healthy pregnancies and lactation. These programs are especially important in areas where diets may lack essential nutrients. In Ethiopia, national supplementation programs are integrated into the health extension program. These efforts aim to reach women and children with vital nutrients, helping to reduce deficiencies and improve health outcomes across the country. Integration with community health workers ensures these programs reach those who need them most. Recommended IYCF practices include early initiation of breastfeeding, exclusive breastfeeding for the first 6 months, safe and adequate complementary feeding, and continued breastfeeding up to 2 years and beyond. These practices are the foundation for healthy growth and development in early childhood. Despite clear recommendations, many families face challenges to optimal infant and young child feeding. Cultural beliefs, maternal workload, limited dietary diversity, and food insecurity can all make it difficult to follow best practices. Addressing these barriers requires community engagement and supportive policies. To improve infant and young child feeding, public health interventions focus on counseling, behavior change communication, community-based nutrition programs, and health worker training. These strategies empower families with knowledge and support, helping them make the best choices for their children's nutrition. Stunting is a sign of chronic undernutrition and cumulative growth failure. It reflects long-term nutritional deprivation and can have serious consequences for physical and cognitive development. Recognizing and addressing stunting early is crucial for breaking the cycle of poor health. Stunting has limited reversibility after the age of 2. While some catch-up growth is possible, cognitive deficits often persist. This makes prevention far more effective than treatment. Early interventions are key to ensuring children reach their full potential. Because stunting is so difficult to reverse, policies must focus on prevention. Early life interventions, especially during pregnancy and the first 2 years, are critical. By prioritizing these periods, we can reduce the prevalence of stunting and its long-term impacts. Adolescence is a time of rapid growth, requiring increased energy, protein, iron, especially for girls. Calcium and vitamin D. Meeting these needs supports healthy development and prepares adolescents for adulthood, including future pregnancies for girls. Addressing adolescent nutrition is an investment in the next generation. Adolescents face unique public health challenges, including undernutrition, early pregnancy, and the emerging issues of overweight and obesity. Addressing these concerns requires targeted interventions and education to promote healthy habits during this critical stage. Good nutrition during adolescence lays the foundation for a healthy adulthood and improves pregnancy outcomes for future mothers. It's a critical period for building strong bones, supporting growth, and establishing lifelong healthy habits. In adulthood, maintaining energy balance and ensuring micronutrient adequacy becomes central. Diet-related non-communicable diseases, NCDs, like diabetes and heart disease, are major concerns. Healthy eating and regular physical activity are essential for preventing these conditions and supporting long-term well-being. Many adults are experiencing a nutrition transition, shifting from traditional diets to more processed foods and reduced physical activity. This transition is linked to rising rates of obesity and non-communicable diseases. Public health strategies must address these changes to promote healthier lifestyles. To address adult nutrition challenges, public health strategies include promoting dietary guidelines, health education, and policy interventions. These efforts help individuals make informed choices and support environments that encourage healthy eating and active living. As we age, our bodies undergo physiological changes that affect nutrition. Appetite often decreases, absorption of nutrients can decline, and chronic diseases become more common. Recognizing these changes is the first step in supporting healthy aging. Older adults are at higher risk for micronutrient deficiencies, sarcopenia, loss of muscle mass, and frailty. These challenges can impact independence and quality of life. Addressing them requires nutrient-dense diets and sometimes targeted supplementation. Supporting nutrition in old age means promoting nutrient-dense diets, providing social support, and integrating care across health services. These efforts help older adults maintain their health, independence, and quality of life. Malnutrition isn't just an individual problem, it's intergenerational. Poor nutrition in one generation can lead to poor health in the next. This cycle is often depicted in public health as a chain that must be broken for lasting change. To break the cycle of malnutrition, we need to invest in girls' education, empower women, and implement comprehensive nutrition programs. These strategies address the root causes and create lasting improvements in health for families and communities. Nutrition shapes health throughout life. The first 1,000 days are especially critical and irreversible. Maternal nutrition affects not just one child, but future generations. Preventing stunting is more effective than treating it, and a life cycle approach to nutrition is central to successful public health programming. For those interested in learning more, recommended readings include Public Health Nutrition by Buttress and ILSA, WHO Global Nutrition Policy Documents, Ethiopia's Food and Nutrition Policy, Food-Based Dietary Guidelines, and WHO Infant and Young Child Feeding Guidelines. These resources provide deeper insights into the science and policy of nutrition across the life cycle. Thank you for joining us on this exploration of nutrition through the life cycle. By understanding and applying these principles, we can all contribute to healthier individuals, families, and communities. Remember, good nutrition is a lifelong journey, one that starts before birth and continues into old age.